Assalamualaikum, it's me Dr. Muhammad Naseem Shirzad, and today I'm going to give some short guideline regarding FCPS Part 1 exam. There are some principles for every exam in life. So before going to exam, you need to follow some basic step, and that's basic step include to do some sort of research. I means if you are going even for a business, first you spare some 1 or 2 days to do some sort of research. Research means to know each and everything about that exam. So for FCPS Part 1 exam, when you are trying to plan for this exam, you need to do some research. Like you need to know about the duration of exam, the number of MCQs in exam, how many time it is going to be held in a year. So you need to know all these basic things. So today I'm going to explain you all these in a very easy way, in a smart way, in order to make it possible on first go, inshallah. So the first step for this was the research. So you need to ask from expert, you need to discuss your problem with them. The second thing is the sincerity of yourself for this exam. If you are not sincere, you will not clear this exam. Remember that this is the basic thing. Because I have seen many students, they are asking again and again, sir, how to study? I have this problem, I have that problem, and they are landing with failure. So what I'm suggesting first you need to decide that I will be going for this exam with sincerity, and I will make it possible, and I will be in the line of all those my class fellows and colleagues who are in this journey. So sincerity is the basic step. If you are not sincere, you will be going again and again for this exam. Now let me explain the book selection for this exam. There are two basic things for FCPS Part 1 exam, and there should be a good balance between them. The first thing is the theory, and on the other hand is the MCQs. Means these actually not MCQs, I can say it is a basic news. Means it's a best choice question. Best choice question means here there will be 4 options, but you need to select, like one will be 100% correct, the other will be 90% correct, and the other will be 80% correct. I just want to give you some example. For example, they can give you that which of the following can occur in terminal ileal resection, and they may will be giving the option of vitamin B12 deficiency. They can be giving you the increased bile salt content of the stool or water stool. So you, from your basic medical science, you must on first click you will be saying, sir, it's vitamin B12, but it's wrong. So you need to choose the most correct, the best choice question, right? So this is one thing which I just tried to highlight and try to show some importance of it. Second is the theory. Now the big problem that everyone who is trying to go for this exam, they just having 3 months or 2 months. Maximum of the time they having 3 months. So now if I want to clear this exam, I will collect my BRS, I will collect my SNAIL, I will be having first aid. But is it possible to cover all these books? Not only to cover, but to cram it, but to write it. Is it possible? Ultimately, it's impossible. So my thoughts and my struggle just to make all these into a single book, a book which will cover all these subjects in a single book. So MNS FCPS High, which I have written with all these intention to make your life easy, to make your preparation easy, to make the last day of your exam easy. So I have written MNS FCPS I and now it's 7th edition currently available, and it's up to the date, and that will be covering all your basic. It will be covering your anatomy, it will be covering your physiology, it will be covering your pathology, it will be covering histology, embryo. I mean every basic of medical science. So this is not just in a theory book, it's written in a modular form. Modular form means if I have given a topic of esophagus. So in esophagus I have divided into 3 parts. The first part is histology, embryology, blood supply, nerve supply, and even pathology. And you need to learn these things in such a systemic and organized way. So MNS FCPS I should be your primary theory book. Now, which book I need to follow with this MNS FCPS I need to have some MCQs book. I need to practice MCQ book systematically before going to start some papers which are haphazard. So currently in market there are various systemic books available. You can select any one of them, but you need to stick with them. Don't change your book again and again. So your main theory book for current is MNS FCPS and for MCQs your main MCQ book which is available in market, you can select any of them. It's all on you. So select one systemic chapter wise MCQ book. So these are 2 books which you need to cover at least in 35 or maximum 45 days, but it should not be extended. I mean more than 40 days because you will be unable to revise it again, right? So maximum you need to cover these two books chapter wise: upper limb, thorax, lungs, CVS, head and neck, neuro, back and general, and going on to the last chapter of histology. So you need to move systemically. Don't compromise the strategy. If you want to cover it in a 40 days, it means you need to have at least 12 dedicated 12 hour, 13s or 14, and as you going near to your exam, you need to increase the number of hours for your studies. Right, so these two books, these at least solved your problem. Now there are thousands of MCQs. How I can revise all these MCQs? So for this, I just gave you some sample formula. Like if you cover one chapter from MNS FCPS, for example, you have covered just upper limb. Now go and start MCQ practice of the same chapter from any systemic MCQ book which is available in market. Now what to do? The important things which I want to highlight it and insist here. When you are going to solve MCQ, you will be able to solve MCQ around 80% on the basis of concept, on the basis of what I have written in MNS. There will be 10% of MCQ, like 10 MCQs, which you will be having some sort of difficulty. Maybe you don't have a proper command on MNS upper limb, or maybe that's missing in MNS because you know it's very difficult to cover each and every part of this MCQ. So that's 10 MCQ, put a big star on them. And again, check MNS. If it's not given in MNS, you need to have some reference book on your table. Reference book means when it's needed, you need to open it and review the topic from there and write the important points under the MCQ, or just go and open the MNS and write it under that topic. So what are that reference book? Like you must have inheard or short form like BRS, like SNAIL, like first aid. Even if you laptop is must to be on your table, notebook must to be on your table, because you need to do some holistic approach. Like you need to make your notes, you need to watch some video, you need to open the Google for some, but that should not be the source to be followed. Trust nowadays the trend is that everybody is going to open the chat GPT and write what is the answer. So never follow the chat GPT answers. You need to have textbook reference. Whenever you are talking with anyone, you need to give a proper reference, and reference should be textbook, not ChatGPT, not any Google site. So this is one formula that I will be putting star on difficult MCQs. With this journey, I will be going ahead and I will complete in 40 days my course. Now, when I complete my course in 40 days, then I will start the revision. Now, how to revise all these things? Revision should be smart. Like how to make it smart? The smart that I will be ratifying, I will be cramming the things which is volatile. For example, I have given that in a tricky box and MNS FCPS side. I have given MNS high yield table. So I will be ratifying that things in the first 2 or 3 hours of early morning, because your mind is fresh, and because this exam is 20% rata and 80% concept. You need to have a balance between both of them. So I will be giving 2 or 3 hours early in the morning for my rata things, right? So start your revision by ratifying the things, and first cover the star MCQs, the one which you have put the star in your first revision. After that, if you have time, you can cover the other MCQ, but I don't think there will be any need, right? So with this, I will be I need to cover the latest 4 attempt MCQs along with this revision. There are books available in market. You can get any of them and try to cover that haphazard MCQs of last 4 attempts. It must. But important things which I want to tell you all, that those MCQ which from your specialty, like for surgery and delight, you need to cover that in depth. Depth means you need to understand the MCQs topic wise. If it is not given in MNS, you need to open some book. Now many students asking, sir, I have, for example, I am going for surgery and delight, so how to proceed for my paper 2? So as from last I think 4 or 5 attempt, I am closely observing the changing in the trend of CPSP Part 1 exam. They are going around 20 or 25% from basic toward the clinical scenario part. Like I have seen, for example, that's a very, what I can say, for example, they are asking the question from orthopedic, and that's asking that extensive classification. For example, for tibia fracture, they are asking the classification. They are giving even for trauma. They are asking the question in trauma. Like in last exam, they asked the question on liver grading, which is, I don't think it's a basic, it's a clinical, and that's asking in IMM surgery. So if you are going for IMM surgery, I would suggest to look into MNS IMM surgery. It is a very short book, around 200 pages, and you can easily cover it if you try to give just 1 or 2 hours along with your main schedule. Give some time to IMM surgery, around 2 hours along with your main schedule. Those going for gynae, I have given a proper chapter which is academic, which is exam oriented. There is a proper chapter and that will be covering all your topic, and I have given that in MNS House Job Guide, a proper dedicated gynae chapter in MNS House Job Guide. So this is for gynae. Now what about anesthesia? What about radiology? MNS is enough. Radiology people need a good command on anatomy, and the anatomy is very properly I have written in MNS FCPS I. So this is some sort of what I can say, a holistic approach. Again, discussion is a key. If you are just sitting with your own thoughts, it's again will be very difficult for you to pass this exam. So you need to discuss the things. You need to have a good colleagues to keep you motivated all the time. Please come, let's discuss. But that should be at the end of the day, right? Not in the early morning of the day, because that's fresh mind. You need to have your own study. The second thing, the social media is the killer of your time, and it's a bad addiction. You need to avoid social media, because that will be not only waste your time, but that will be making shatter your concentration. So better to use social media at the end of night when you are going to sleep, just for entertainment. Open it for an hour or 2 hours, not in every part of the day, otherwise it will waste a lot of your time. That's what I'm saying, that exam needs sincerity. These all need sacrifice. Now those with job, like many asking me, sir, I have 2 jobs, some saying 1 job. So you need more hard work, and there should no excuse be in your way to make delay or make your life miserable. You need more work hard as compared to those who is having no job. So all those with job, you need to work hard. Even you can take a picture in your mobile, and even in Word you can spare some 10 or 15 minutes to revise what you have saved in your mobile into. But again, what I am saying, there's need sincerity. If you are sincere and all the time the thoughts on your mind that I want to clear this exam, so you will be studying all the time. Number second, your study should be persistent. It's not should be emotional. Emotional means that one day I decided, yeah, I want to clear this exam. You sit for exam around 12 hours, but for next 2 days you are totally out of screen and you are not studying. You will be unable to pass this exam. If you are studying 10 hours, you need to study 10 hours the next day, and the first and second day thoughts should be continued. If there is a breakup in your thoughts, again this will be difficult for you to pass this exam. So this what because I want to record this video, because it's very difficult for me to respond each and every person on my social media platform. Some will be asking at night time, 1 o'clock, sir, I have this problem. Maybe yes, he is in trouble, but I am responding them. So I thought, why not to record this video? Inshallah, this video will help, and hopefully this will make your life easy. I wish you all best of luck. Again, if you have any question, you can just visit MNS book series. I wish you all best of luck. Thank you.